Hi, everyone. My name is Kennie Brandt, and my project is titled FDA-Approved Drugs Stimulate Lubricin in Vitro, and this was a 3D phenotypic screen for disease-modifying osteoarthritis drugs. So, as you might already know, osteoarthritis is a very common and potentially debilitating joint disease caused by the gradual loss of articular cartilage. Inflammation to the entire joint and periarticular structures leads to chronic joint pain and stiffness, and currently no treatment exists, which is curative. Discovery of a disease modifying osteoarthritis drug, which could prevent, slow, or even reverse disease progression, could drastically improve patient outcomes. And repurposing a drug that is already FDA approved could expedite translation to the clinic. In this experiment, we screened an FDA approved drug library for stimulation of lubricin in a 3D injured chondrocyte model. Lubricin is a key endogenous peptidoglycan which provides lubricating and anti inflammatory properties to healthy joints, but is lost as OA progresses. Our overall hypothesis is that the targeted stimulation of lubricin is key in modifying the progression of OA. In order to test this hypothesis, we selected 52 FDA approved drugs with mechanisms of action thought to be involved in chondrogenesis. We cultured human donor chondrocytes, genetically modified to express a luminescent reporter under control of the lubricin promoter, and formatted these cells into 3D aggregate culture. After a 12-day growth period, we injured the aggregates with interleukin 1 beta and then subject them to serial treatments with our selected drugs every 48 hours for 8 days. We measured luminescence at baseline, after injury, and after each treatment period to track lubricin expression. In figure 1 on the left, you can see the results of all 60 experimental wells. In all three of these figures, you are seeing the average luminescence expressed as a percentage of day 12, or the pre-injury luminescence. We normalized the data this way to account for any differences in pellet size or lubricin expression at baseline. The vertical axis of the heat map shows the different drugs codified as the well number in the 96 well plate, and the horizontal axis shows the different time points. Values are at 100% on day 12 because this is the pre-injury luminescence, which all other points were normalized to. Day 13 is 24 hours post-injury, and we see about a 50% drop in lubricin expression across the board. After this point, you can see the results start to diverge as the cartilage aggregates are treated with the different drugs. To identify any hit compounds, we used multiple unpaired t-tests at a false discovery rate of 5% versus the vehicle control, which had basal media conditions and 0.1% DMSO. In figure 2, we have isolated the drugs which significantly modulated lubricin expression at least one time point. We identified 9 stimulatory compounds, shown in the top figure, and 7 inhibitory compounds, shown in the bottom figure. Stimulatory effects were primarily observed on day 17. Our main takeaways from this experiment is that our screen was able to rapidly identify multiple FDA-approved drugs that stimulate lubricin expression after chondrocyte injury. The primary limitations of our initial screen are the use of a single donor and testing the drugs at a single concentration. In future experiments, we will perform dose-response assays to find the most effective concentrations for these drugs and test them in cells from multiple donors. We hope that these drugs will ultimately advance to testing in mice, to human trials, and one day be used in the clinic as disease-modifying osteoarthritis drugs. We are, of course, very grateful to the donors and families who provided us with tissue for this experiment and to the UCF College of Medicine. Thank you.